You can go ahead and start.
Okay. Welcome to the very first episode of Gynecollege, the Facebook Live events produced by Women's Healthcare of Princeton in Princeton, New Jersey, where we'll discuss topics related to women's health and wellness and safety and sociocultural issues relevant to women of all ages. My name is Dr. Maria Sophocles, and I founded Women's Healthcare of Princeton in 2007 with a mission to bring progressive and excellent healthcare to the Princeton and Mercer County, New Jersey area. I'm really excited to talk to you tonight about COVID-19, specifically myths associated with the COVID-19 vaccine. My guest tonight is Dr. David Herman. Dr. Herman is an infectious disease physician and the hospital epidemiologist and the chair of infection control at Penn Medicine Princeton Medical Center. And I heard Dr. Herman speak over a week ago, I guess, and gave a wonderful presentation to the physicians and clinicians in our hospital community. And I felt it was really important that he join me tonight to bring some clinical expertise and help all of you understand what is and isn't true about the COVID-19 vaccine. And by the way, you can type in questions and ask us questions. We'll go just for 30 minutes. We don't want to take up too much of your time, but we understand that this is super important. So at the end of our 30 minutes, if you do have questions, we'll be happy to stay online and answer your questions. So Dr. Herman, welcome. Thank you so much for joining me tonight.
Thank you for inviting me. And I think it's wonderful that we have so many people viewing tonight. People are thinking about vaccines. They need to base their decisions on whether to take a vaccine on facts. And the problem is we all know there's so many myths, as you titled this, out there, and people hear the myths and they don't know what's true and what's myth, what's a fact. And so it can become very confusing. So our goal tonight is to try and clarify what the real facts are. Because if you're going to make decisions, you should base them on facts.
Exactly. It sounds simple enough, but we're so flooded with information between social media channels and newspaper, magazine, internet, and friends and family, and fears that are sometimes based on someone who knew someone who had a sore arm, or someone who was told that they're that it's not safe for older people or younger people or blacks or whites. And I think it's these facts get passed along as truths. And I think it's really important that we clear it up for the community, because while the vaccine is in short supply right now, there will be vaccine available for everyone. And it is important that if you want a vaccine and it's able to you, that you can make a clear and good decision for you. So let's talk about some of the myths that we—
Sure, let's start with our first slide then. So I'll let you introduce it and then I'll talk.
Well, one of the first myths was that the vaccine was developed so quickly. Everyone knows about Operation Warp Speed and the fact that billions, $18 billion was poured into getting vaccine development. And it was developed in really record time, unprecedented time. But that brought with it a lot of fear that perhaps corners were cut or something wasn't done right, or someone's not telling us something, and perhaps the vaccine's really dangerous. And it's just too new, so it couldn't possibly be safe. Help us understand about that.
Yeah, so one of the things people need to understand that there are different types of vaccines. So this is a new type of vaccine in that we're using what's called messenger RNA technology, although the technology is not new. It's been around for 15 years or so, and it's been used in other therapies, for instance, in cancer therapies. So it's a new technique for vaccine, but it's not a new technique. And part of what makes it go faster is that, as people may know, for instance, the influenza or the flu vaccine has to be grown in eggs. Well, it takes a long time to grow something in eggs. So right then and there, it's going to take more time. Whereas this is something that can be made genetically. It's not made from eggs. So if anybody has egg allergies, they don't have to worry about it. We'll talk about that later. But it's able to be made faster because of the type of technology. It's something that goes quicker. And furthermore, because of this Operation Warp Speed, They removed a lot of restrictions that would slow down processing of vaccines, and so it's able to be made quicker. And so it's you put all those things together, and we do get a faster turnaround time. But it doesn't mean it's unsafe. It still has to be checked for the way by the FDA and by other technologies to make sure that everything is safe.
I think that all makes great sense, and I hope everybody out there followed that line of thinking, which is just that it's about the way it's made, that it was able to be made so quickly. What about the fact that it's not been out for years? Should we worry about that?
No,
Should we
because
wait for something to be out for years before we consider it safe? Is there logic in that?
so even though it hasn't been out for a year, it was studied in trials for a couple of months before it came out. And I was actually listening to a talk by some of the vaccine experts, and none of them could think of an example of any vaccine that turned out to have some long-term side effect that wasn't seen within the first 2 months. People have to realize that there were tens of thousands of people in these trials that were followed for a couple of months. And when people worry about side effects like something happening like Guillain-Barré or an allergic reaction, that's something that happens in a few days. It's not something that happens months or years later. So I really don't think that that's really anything to be worried about.
Okay, that's really reassuring, because I hear that explanation all the time for why people aren't going to do it, because they say, well, I got to wait for it to be out for a year or a few years. And in this case, we're going to miss our opportunity. We're going to miss the opportunity to really change the course of this pandemic. So I hate for people to be held up by that. Let's go to the next slide and talk about some of these other myths.
Right. So in our next slide, it's talking about what the vaccine contains. And the vaccine, the myth is that the vaccine contains virus. So people are thinking, well, if I take that vaccine, I'm going to get COVID infection. But the reality is, as we'll see on the next slide, there is no virus in the vaccine. And so it is not possible to get infection from this vaccine, because the vaccine contains something called messenger RNA. And the way that works is the messenger RNA gets into the body, and it stimulates the body to produce a protein to the RNA, and it's the protein that makes antibodies that helps people fight off infection. But the RNA is readily destroyed and gone in a very short period of time. It doesn't stick around. So it's not possible to get COVID infection from the vaccine, because there's no COVID virus in the vaccine.
That is so important. It's so basic, but it's so important. And I know some people get a flu vaccine and they get flu-like symptoms. So I think it's easy to mistake that you could get COVID or a mild case of COVID. But it turns out you really can't get COVID from this. We'll talk about some of the side effects you can get from this and whether they're worth the risk. But I love what you taught me, and which is on the second part of this slide. And you want to go over that with the audience?
Sure. So people are worried about the risk of death, dying from taking this vaccine. Well, out of the 20 or more million doses that have been given so far, do you know how many people have died from this vaccine? Zero, none. And if you just look at COVID infection is rampant in our country and in the world. And if you I calculated the odds by looking at the population of New Jersey and how many people have died, and nobody's died from the vaccine. But people have heard about getting a reaction to the vaccine called anaphylaxis, which could be a serious reaction. But you're 387 to 1,143 times more likely to get COVID infection and die from the COVID infection than you are to get anaphylaxis from the vaccine. So if you're playing the odds are you're going to get COVID and die from it 1,000 times more than you're going to get a bad reaction to this vaccine. And the bad reaction to the vaccine is not death. Nobody has died from the vaccine.
Right. And even if it happens right away and you're there being observed. Remember,
Right.
You have to be observed after you get the vaccine for 10 or 15 minutes. And if you're someone who's had serious reactions to vaccines before, we make you get observed for 30 minutes. And
Right.
I think if anything bad's going to happen, it's going to happen right then and there. So let's go to the next slide so we can get through these so we have time for questions. Tell me what else is in the vaccine. People worry about additives and preservatives. A patient today said to me, I'm worried that there could be aluminum in the vaccine, and that will give me cancer. I'm pretty sure there's something in this vaccine that will give me cancer. What's in this vaccine besides the mRNA?
Right. So besides the mRNA, there are lipids, which are like fat cells, and that's the lipids that carry the RNA in through the vaccine into the body. Buffers, which just help alter the acid and base balance so that it will be absorbed properly, and some sugar. And that's pretty much all that's in there. There are no eggs. It's not grown in eggs like the flu vaccine. There's no preservatives. There's no gelatin. Some people have latex allergies. There's no latex in here. So there's really very little that somebody would be allergic to.
That's
And
great. That's great. Because we need widespread use of it. So
right.
I'm sure they figured that out. That's good. Thanks. What about its safety across the board? Let's go to the next slide and see if we can talk about this vaccine as something for basically everyone right now over the age of 16. Is that right?
Right.
Or 18, one of them, 16
Depending on
another.
which vaccine, right.
Yeah, would you address that a little bit for us?
Right. So the vaccine trials were not just in the United States, but they were around the world. And there were different people that took place in the vaccine and people of different races and ethnicities. And it was just effective in each one. There was no difference whether you were white, whether you were black, whether you were brown, whether you were from Asia, whether you were from Africa. Everybody got the same result. So it was very protective. And that found out to be 95% protective in preventing preventing COVID. And it's even more important, nobody that got the vaccine or I think actually one person out of about 40,000 got a serious COVID infection. One out of 40,000. And there were many people that got the placebo, that got but didn't get vaccine, that did get COVID, and some even died. So it was very, very protective and barely protective about even if you would somehow get a mild case of COVID, it's not serious. You're not going to end up in the hospital.
Sure. And again, for the Pfizer vaccine, is it 18 and over, and Moderna is now 16 and over?
I
Can you
believe
correct
that's
me?
correct.
Is
Yeah.
it correct? Okay. And I just read that they are now going to allow kids 12 and over to participate in trials, which is good because it means then we'll have data which will make us all more comfortable letting a child 12 and up get the vaccine as well, which is part of the step towards getting schools reopened and getting us back to some semblance of normalcy, I guess. I heard that recently. I hope that happens.
Right. All right, we can go on. Yes.
Let's keep going. So a big myth, and as an OBGYN, this I get asked all the time, does this vaccine cause infertility? So I'm going to answer this question, David, if that's okay.
All right, this is your expertise.
Well, not really, but it's what I get asked all the time. So I had to learn. I had to actually learn where the myth even came from. So does it cause sterility or infertility? This has been on social media now since December. And the real easy answer is no, absolutely unequivocally no. The mRNA of the vaccine, the beautiful thing about using mRNA is that it doesn't enter into the nucleus of the cell. So it cannot change the DNA of a cell. So to cause infertility, you really have to alter the DNA of the cells in the ovaries for a woman to become sterile. And you cannot do that with an mRNA vaccine, even if you wanted to, even if we were in some diabolical way trying to, it just won't work. That is not where the myth started. That's just you guys understanding about why the way this vaccine was made is not possible to be linked to infertility. In fact, 10 women who got the vaccine during the trials got pregnant while they were getting the vaccine. So it wouldn't even make sense that it causes infertility if those 10 women got pregnant. If you'll go to the next slide, I think that might help us understand a little bit about this myth. So this myth came from a German doctor and epidemiologist. I'll spare you his name. And he was looking at the sequence of amino acids that make the spike protein. Everyone knows what the spike protein is. It's part of the coronavirus. And it's a part that's been, David, how would you say, sort of mimicked in the vaccine? Is that how
Right.
you, right?
Right.
So in that spike protein, there's a little tiny bit of the amino acid sequence that is similar to a protein in the placenta. Interesting coincidence, but it's just a coincidence, and it's just a very tiny, tiny 7 amino acid sequence, not nearly enough to actually have any effect on anybody's placenta or on anybody's pregnancy or on anybody's ability to have a future baby, to have a baby in the future. So it's only the similarity between the sequence of this placental protein and the amino acid sequence in the spike protein is less than 1%. It's 0.39%. Now, for there to be true cross reactivity where the body would mistake one for the other and somehow it would affect placental development or health, you'd need almost 100% of those amino acids to be alike. So we're not at 100% or 90 or 80 or 70 or 60. We're not even at 1% similarity. And I said to Dr. Herman the other day, it's as if someone said, Dr. Herman and Dr. Sophocles, you have the same phone numbers. And we actually don't. We both just happen to have a 7 in our phone numbers. No one would ever call us by mistake, call the other one. So this doctor and epidemiologist found this small little thing and really blew it out of proportion. He went to Pfizer. He asked them to halt the trials. It was all incredibly overblown. He then published this all on social media and it went viral. But it turns out it was much ado about nothing. And I think I said before that we really feel very confident in saying that this myth is completely debunked. That's it.
Absolutely.
Okay.
So an important thing to keep in mind from this is that we're not even talking about someone who's pregnant yet. We're talking about somebody that's maybe thinking of become pregnant in the future, want to start family planning in the future. That's the ideal time to get the vaccine because it's not going to change your fertility. It can't change your eggs. It can't change your DNA. So it's really a non-issue. There's absolutely nothing to worry about if you're not pregnant.
Right. So let's use that as a segue, this conversation, and talk about pregnancy itself. So what about pregnant women? What do we think? Can pregnant women get the vaccine?
So the issue that people are concerned about is that in the trials, they did not include pregnant women, although as Dr. Sophocles mentioned, 10 women did become pregnant and they did fine, but they didn't include pregnant women. So there's really not much data on pregnant women taking the vaccine. However, we do know there's plenty of data on what happens to pregnant women if they get COVID infection. And
That's
pregnant
the next
women,
slide. So let's do
okay.
the next slide.
All
Sorry.
right, let's go on to the next slide. Sure.
Yeah.
So pregnant women who do get COVID infection have a markedly increased risk of having a bad outcome, both in terms of themselves becoming quite ill, maybe ending up in the intensive care unit, maybe even having respiratory failure and have to be put on a breathing machine, a ventilator, or even dying. And the risk is higher than the general population. So if you are a person who is working in an area where you are likely to be exposed to COVID, you need to weigh all these risks because if your chance of getting COVID is high, we know that you might do very poorly. If you get the vaccine, so far there's been no data to show and nothing theoretical even to think that you would have a problem with the vaccine. We can't give a strong recommendation for all pregnant women because there's not enough data yet. But when they looked at laboratory animals that got it, there was no problem. And the real world population, there hasn't been any problem yet.
All right. So we're hopeful. We're hopeful that
hopeful.
eventually there'll be enough data with pregnant women that we can give a wholehearted thumbs up for all pregnant women to be vaccinated. At this time, it's still individual risk and discussed with physicians.
Right.
There is some late breaking news I'm going to add to this, which is that there's a team of OBGYNs at Duke University who are looking at COVID in women who are willing to be vaccinated. And they've gathered a group of women who are pregnant and accepting the vaccine, and they're following those women. And so far, those women have had a lower incidence of problems and of getting COVID than the women who were pregnant who didn't get the vaccine. So this team at Duke University is very hopeful that at least theirs will be one of the first studies to show the benefits to getting the vaccine in pregnancy. They also issued a statement saying that just what you said, that pregnancy itself significantly increases the risk for a woman who has COVID to get severe COVID infection. And there are specific criteria now for severe COVID infection. So we certainly want to get all women vaccinated who are thinking of getting pregnant.
Right.
And some of the women who are at high risk of COVID exposure should consider it, should definitely consider it.
Absolutely.
What about breastfeeding? Because once they're pregnant, many of them going to ultimately be breastfeeding.
So in terms of breastfeeding, it's totally safe. There is no reason at all to think that vaccine would cause any problem. It's probably none of the vaccine would even get into the breast milk because the RNA is destroyed in the body very quickly. And we know that if you would, therefore, if the vaccine worked and you produce antibodies, it's possible, we don't know yet, but it's possible that some of the antibodies that the mom makes could be transferred through her breast milk into her infant, and that might actually protect the baby. Because you can't really vaccinate babies or infants for anything. They don't have a strong enough immune system to produce antibodies, so it wouldn't work in a little infant. So the infants depend on mom's antibodies, and it could be, we don't know yet for sure, but that this might also work to help protect the infant.
Right. It could theoretically be the only way you could give your newborn baby some protection.
Right.
But you're definitely not harming a baby. You don't need to pump and dump. You don't need to say, oh no, I can't breastfeed my child because I had the COVID vaccine. Quite the opposite. Quite the opposite.
And one other thing to mention before we get off of this is to remember that other vaccines are given to pregnant women. For instance, flu vaccine has been shown to be very safe in pregnant women, and Tdaps are given to pregnant women. So there's plenty of other vaccines that are, and there's no reason to think that it's going to cause any kind of problem.
Yeah, I think a lot of the hesitancy is just from misinformation, mostly through social media. So again, if you're listening and you feel empowered by what you've heard, I hope you'll share this presentation. You can share it. It'll be up on YouTube, or just share it through your friends. Just tell your friends and your family what you've heard, so that if you have a friend or family member who's not breastfeeding or who's not getting the vaccine and would benefit, they'll hopefully listen to what you say. The CDC, in fact, has even said mRNA vaccines are not thought to be a risk to breastfeeding infants. And the American College of ObGyn has said we don't even find vaccine components itself in breast milk. So bottom line, vaccinated moms can and should continue to breastfeed.
And as we said, we strongly encourage any woman who is pregnant to discuss her own individual risks for getting COVID infection with her obstetrician and decide whether the vaccine would be a good idea for her or not.
All right, so let's recap for women of childbearing age. Would you run through that?
Sure. So women planning to get pregnant should definitely be vaccinated. There were plenty of women in the trials who were planning to get pregnant in the future, and they did just fine. There is nothing at all to suggest, and it's really not even possible, that the vaccine could affect your fertility. Women who have already had COVID, yes, if you've already had COVID, we don't know how long the natural immunity from the COVID infection will last. And so as for other people, we still recommend they get the vaccine, not when they're acutely ill with COVID. You want to be over it. We don't want somebody that's acutely ill with COVID coming into the vaccine center and coughing and infecting everybody else. But after you've recovered, definitely. Breastfeeding, we just spoke about. Again, it's very safe. It may even protect the baby. We don't know that yet, but there's no reason at all to believe that it could harm the baby. It's not possible. For pregnant women, that's the one issue where you need to discuss it with your obstetrician. There's no data that shows that it's harmful in a pregnant woman. It's just that there's not much data on pregnant women because they weren't included in the trials. But we do know, as we stressed before, that if a pregnant woman gets COVID infection, not COVID vaccine, but gets infected with COVID, they have a high risk of having problems, both for themselves and for the baby. And so if a woman is a healthcare worker or maybe works with the public, like in a grocery store or something, where you're around lots of people, a restaurant, or any place else where you're around a lot of other people and you have a high risk of getting COVID, you need to think about it, because if you get COVID, you might not do so well. Pregnant women at high risk of getting COVID should be vaccinated, according to the American College of Obstetrics and Gynecology. And the CDC and the World Health Organization also say that they should consider it. They don't say no, they don't say yes, but they say it should be an individual discussion with your doctor. Someone who's immunocompromised can certainly get COVID vaccine. It is not a live vaccine, so it can't cause any harm to somebody that's immunocompromised. The concern is that if you don't have a good immune system, you might not make a lot of antibodies, so it just might not be as protective for you, but it's not going to harm you. So really the only people that absolutely shouldn't get it if somebody has a known history of a severe allergy to vaccines, like anaphylaxis, where you stop breathing and your throat closes, or if you somehow knew you had an severe allergic reaction to mRNA, I guess if you've gotten it for chemo or something before, then those would be people that you wouldn't give the vaccine to, or at least they should consult with an allergist and find out what their allergic reaction was and whether it's something that would be predicted could be a problem here.
That's an important last point, because many people say they're allergic to something, but it really was that they had a sore arm or they felt achy or feverish, and in their mind, that's an allergy.
Right.
Those are not allergies, and if you're not sure, you can ask your doctor, or you can even go see an allergist. An allergist can help you understand, are you truly allergic or not? And if you're not truly allergic, that's really important, because it means you are a candidate for this vaccine. And you sure don't want to deprive yourself if you don't have a true allergy. Having a true allergy to vaccine is a pretty rare thing. So let's talk about side effects, actually, serious and not serious.
So the risk of serious side effects, which would be something called anaphylaxis, to the Moderna vaccine was seen in 2.1 patients per million that got the vaccine, 2 out of a million. And for the Pfizer, it was 6 out of a million. But if we look at the statistics and compare this to the risk of getting COVID infection in New Jersey, 74,000 people out of a million have already been infected. So you're comparing 74,000 to 2 to 6. And the risk of dying from COVID in New Jersey, these were statistics that I calculated on Sunday, so it might even be a little bit higher by now, was 2,400 people die per million already, per million. So the risk of dying from COVID infection is way, way higher than the risk of having an anaphylactic reaction to the vaccine. And again, nobody has died from the vaccine. Those that had anaphylaxis got treated and did okay.
Mm-hmm. Mm-hmm. And I love these statistics, because I'm not a numbers person, but even I can relate to something that is 1,000 times more likely. And you can make your own simple calculations of something, and saying, am I more likely to die getting struck by lightning? For example, you're much less likely to have a serious side effect from this than you are to get struck by lightning. And I think most of us don't go around worried about getting struck by lightning unless we insist on golfing in a thunderstorm. So I think that if you think of it like that, it's sort of like when we're afraid to swim in the ocean because we're afraid of sharks. And I'm certainly afraid of sharks, but statistically it's pretty rare. And same here, you're much more likely to get COVID and even to die of COVID than you are to have a problem with the vaccine. So those are serious side effects. What about I think the common things, the more mild things, the things we shouldn't really worry about, but people still worry. They don't want anything.
Right. So of course nobody wants side effects, but it is common to get soreness at the site. But when I get a flu shot or I've had a tetanus shot, my arm's a little sore for a day or two. And when I got my COVID vaccine, my arm was sore for a day and then it went away. So no, nobody wants a sore arm, but I'd certainly rather have a sore arm than end up with COVID and be in the hospital and very sick. Some people are fatigued for a couple of days. They just feel tired, get a headache, muscle aches, some chills, joint aches, and a small percentage do get fever. But again, these are things that generally last a day or two at most, and then they're gone. And as Dr. Sophocles actually pointed out to me, these are, in a sense, good news, because the reason you're having these side effects is because you're producing some inflammation from the vaccine. And the inflammation means that you're making a good immune response and you're forming antibodies, which are helping you fight off the COVID. So yeah, it's a little uncomfortable maybe for a day or two in some people, but it means the vaccine's working.
I think any confirmation that something you've done is working is not only positive feedback, but you have to think about taking this vaccine, in this case, because it's a pandemic, as not only an individual sacrifice, right? I'm sacrificing a sore arm or aches or fever, but something you're doing for your community, your family, your friends, your workmates. I think that we all need to, it sounds so corny, but you need to think of this as, am I willing to have some fatigue and headache and muscle aches to make my society this much better? Because if we all do a tiny bit, it really adds up to to a community that's safer and that's more quick to get back on its feet economically. And I'm not standing on any political pedestal here. I'm simply saying that when I tell my patients to get mammograms and they say, I don't want to get a mammogram, it hurts, I tell them, breast cancer hurts as well. And breast cancer probably hurts a whole lot more for a whole lot longer than the mammogram. And I think it's the same here. If you can go in there predicting you're going to have soreness and fatigue and headache and say, well, this is what I'm going to do. And if it makes you feel better, treat yourself. Say, well, I'm going to binge watch Schitt's Creek or something because I got my COVID vaccine. Then do it for yourself. But do this for yourself and for your community. And I think then, you'll embrace the side effects as good things that you're willing to do to make our country get back on its feet a little better. That's how I looked at it anyway.
Absolutely. So as we said, most reactions are very mild and short-lived, but what you also have to remember is if you get COVID infection, all the reactions are not necessarily short-lived. So people that have COVID disease, some of them, maybe you've heard about them, it's called the long haulers, they can have an infection, their infection might get better, but they can have side effects, very much fatigue, shortness of breath, cough, muscle aches, brain fog, it can go on. And some of these side effects can last for months and months. So they don't go away in a day or two like the side effects from the vaccine.
Okay, important to make that distinction. Side effects from the vaccine are very short-lived. COVID infection side effects can really drag out. I have patients who had COVID in March and they are still having joint issues and eye issues and respiratory issues. And I don't have any idea when these will stop. And boy, I bet those people wish they could have been vaccinated. So let's just make one last little statement about side effects, Dr. Herman, and how in our country there is something called the Vaccine Adverse Event Reporting System. It's run by the CDC. And I think it's important to understand that you can report a side effect. You can, I can, anybody can. But that you don't have to be a researcher and you don't have to be the 500th case of joint pain or anything. Anyone can. That's good news. The bad news is it can be misleading, that just because something is reported and listed as a side effect does not mean necessarily that the vaccine caused that. Can you comment on that?
Right. So there's certain things that happen to people during the year, like take, for instance, something called a Bell's palsy or a facial palsy, a facial droop. People get them. That happens. And if you vaccinate millions of people, some of the people that get vaccinated are probably going to get a Bell's palsy, but most, they would have gotten it anyway. There hasn't been any increased association. If there really was, then we'd be seeing loads of Bell's palsy because, millions of people, 20 million, over 20 million people in the US have already been vaccinated, and we're not. But a couple people will get it because we get these things anyway. And if they got it after the vaccine, they're going to attribute it to the vaccine. It's kind of like if you get food poisoning after you ate some particular dish, maybe the dish was bad, but it had nothing really to do with that. But your body's going to say, I'm never going to eat a hamburger again because I got sick after I ate a hamburger, even though it really has nothing to do with it. It just happened to occur temporarily. And so people put the two together.
Right. The phrase we learned in medical school was correlation does not equal causation. But just because something happens around the same time that something that you take a medication does not necessarily mean that medication or that vaccine caused that. So you have to keep that in mind because everybody knows somebody who had an uncle who got a vaccine or took a medication and then had a stroke or had a heart attack or whatever. And that stroke or heart attack may have occurred anyway. So be very careful when you hear that someone had something happen right after they had the vaccine dose, because you just don't know that they're linked.
That they're related, yeah.
Right. So we've got to wrap this up, but I think the next slide is one of the most important. It's something that the World Health Organization put out before the COVID pandemic, that vaccine hesitancy, the reluctance or the fear or the worry that keeps one from getting vaccinated, is one of the top 10 threats to global health. So Dr. Herman and I are so committed to helping our community get vaccinated and helping you all get your questions answered. But this is a global problem. It's not just people in Mercer County being hesitant to get the vaccine. We know there's fear. There's always fear about new medications, and there are, particularly with vaccines. But I hope some of what you've learned tonight, and some of what I've learned from Dr. Herman, and some of what you've learned from both of us will help you to at least be curious to get the right answers to some of your questions and hopefully get vaccinated. Dr. Herman, is there anything else you'd like to say?
No, well, right here are some websites for people that want to read a little bit more. So there's several that you can snap a picture of or look at it later. But they have some good advice. I think you do want to be careful, you know, as we see as doctors in the office, people come in that have done reading on the internet, which is good. I love it when my patients try and learn things, but anybody can post anything on the internet. And just because you read it there doesn't mean it's true. So I would try and go to sites that have been validated, like the CDC and this COVID-19 NewJersey.gov. And you found this Vaccine Confidence and Unbiased Science podcast that have a lot of excellent information.
Vaccine Confidence is started by one of the public health vaccine experts, one of the most renowned experts in the world. And he and a professor got together to decide to kind of start an initiative called Convince, which has to do with informing and clearing up myths, a lot of what we're doing tonight. And this is the website that you can go to, and there's lots of articles, and there's lots of good information. The Unbiased Science podcast is just two physicians who have made it their nerdy hobby to publish podcast reports on certain topics, and they do 3 in a row on vaccines, not just COVID, but also COVID. And I think they're fun, and they're funny, and they're easy to listen to, and they're very clear about staying true to the science. So I think these 5 are nice links for you all. And please, if you have questions, don't hesitate to contact me at www.princetongyn.com. I know how to reach Dr. Herman, so you can always contact me, and I'll ask him if I don't know, which is certainly possible. But
we teach each other.
Yeah, and we really appreciate that you took the time to listen tonight. And you know, stay safe. There is a question, David. You want to do that one?
Yeah, so have the deaths in Norway been fully investigated? Why have they backtracked on giving the vaccine to the frail and elderly? I don't think it has been fully investigated. They're looking. Number one, I'm not sure why it would be different in Norway than any place else, and nobody else has reported this. So you wonder if it's true, even if there's something different about their way they're administering the vaccines. It's the same vaccine. I believe it was the Pfizer vaccine that they were using in Norway. And secondly, let's keep in mind that when you look at the elderly and frail here, New Jersey was hit very hard at the beginning because it went in and hit the nursing homes. And we lost, 25% of people living in nursing homes died. And it was a huge number of elderly, frail people that died from COVID infection. So you didn't see huge numbers of people dying in Norway. And I just don't know that it's fully been investigated, if all of them, if it was really the vaccine, or some of them were getting COVID around the same time as the vaccine before it could protect them. I just don't know. So we'll have to get more information on that. But again, one would think that if it was a problem, why wouldn't it have been seen in all these other countries that are giving the same vaccine? We certainly haven't seen it here.
I think we have to look into it and wait and see. Yeah. Ann Fisher's question, can you take Tylenol for a side effect, or will it dilute the vaccine? I'll take this one because it's easy. We saved the hard stuff for him. It will not dilute the vaccine. The vaccine is in, and it's a 1 shot or 2 shots rather. But once it's in, there's really no medicine you can take that will dilute it or will interact with it. So if you're on a statin, you can take your statin. If you're on a blood pressure medication, you can take your blood pressure medication. Tylenol is perfectly fine, and I think it's a great option for fever, aches, sore arm, anything like that, if you feel you need something.
And in fact, Tylenol is probably the safest to take, as opposed to taking something like Advil or Aleve. Theoretically, and we don't even know, but theoretically, as we talked about earlier, the inflammation, when you get some pain in your arm and inflammation, that's helping you make antibodies. So if you take a medicine that's an anti-inflammatory, which is what something like ibuprofen is, then maybe, we don't know, but maybe that could decrease the efficacy of the vaccine a little bit. It's all theoretical.
Right.
The Tylenol
so Tylenol's
is inflammatory, so that's the safest.
Yeah, it's the best choice for that. Good question, though. Good
Yeah,
question.
excellent.
Any
Okay.
other questions anybody has? Good. Well, we are so glad to have you and with us. And Dr. Herman, I look forward to our next chance to get to chat together.
Great.
Do you want me to do this one more? What is the
Sure.
best thing to say to those anti-vaxxers who have a hard time accepting the safety of vaccines? Oh boy, Karen, that's a tricky one. I think a lot. Go ahead.
Well, it's not based, there are anti-vaxxers, there's anti-everything, but it's not based on any good studies. So it's like there's anti-vaxxers that are still insisting that the measles, mumps, rubella, MMR vaccine causes autism. That's been debunked in study after study after study. It's not true, but some people, that's just what they want to believe, and they're very organized and they really fight taking any vaccines. But if you look in the history, I think the vaccines is probably one of the best things that's ever happened in modern medicine. If you look at how people used to die from smallpox and now it's all gone, polio, we don't see polio in this country anymore, and many other things, vaccines have really kept us alive instead of, people dying in their 20s and 30s as they did in the old days because there was no way to prevent these things.
And even a vaccine like HPV, where it may not cause an immediate death, but is just lowering the risk of multiple cancers. In countries where HPV vaccination is well engaged in the medical community and they have a high rate of vaccination, the cancer rate has plummeted. And in countries like ours, where only 16% of youths are vaccinated, we haven't seen that decrease in cancers yet. So it's the data is really clear. And I have patients whose parents won't let them get HPV vaccine because they somehow link it to sexual activity and feel their child is going to run out and have sex. And I don't know any teenager that bases their sexual activity decisions on whether they have an HPV vaccine,
Right.
or most don't, I think. Sorry. But I think that you're right. It's one of the single best things we can do as a healthcare community is to get our patients vaccinated and to have our patients help be ambassadors for vaccines and advocates. So Karen Leahy, I'm counting on you to help us.
But the other thing to remember is some of the anti-vaxxers, that's their opinion, and no matter what you say, you're not going to change it. So I wouldn't get into a big drawn-out fight with them. They're going to believe what they want to believe, but you just should understand that it's not based on any scientific facts.
Right. So the person who signed in late, yes, there is information regarding infertility, and we showed, and you can watch this on YouTube. It'll be up on YouTube that there's absolutely no risk of infertility with this vaccine. Yes, the vaccine needs to continue to be researched and tried, and there are trials ongoing, but not with regard to fertility. We know that the way the vaccine works is that it does not alter the DNA of human cells that relate to fertilization. So it cannot cause infertility.
Impossible.
Yay. Impossible. All right. Good questions. All varied good questions.
Well, thank you, everybody.
Thank you, and have a good night. And thank you again, Dr. Herman. Go eat your dinner late. And thanks so much. Take care.
Have a good night. Bye-bye.